All right, everybody, let's do a topic on blood transfusions. Before we discuss or dive in, hope you have a great day. Realize a quote of the day would be, every time you state what you want or believe, you're the first to hear it. So whether it's a score, whether it's something you want to do, whether you want to work out, anything, a goal, it's a message to yourself and others that you think is possible. Don't put a ceiling on yourself, AKA set a goal. So take-home point is be positive, believe in yourself, say it out loud, write it down, all right? Just make sure you're not saying it all the time to the same people, because those people are going to be like, shut the, you know what, up, and we don't want to hear it. So take-home point is make sure you tell yourself. That's the most important thing. My advice for the day is choose 2 to 3 critical things that must be done and do them. Making a to-do list with 1,000 things is like 10 years ago, people thought that was productive. Currently, I realize that the most productive thing you can do is being focused. So 2 to 3 things, do them well. Learn to surrender, learn to talk less. What do those mean? Learn to surrender is if things aren't going your way, it's okay. Let it happen. Let it ride. Be mature, just observe and watch, right? While 99% of people get stressed out, they'll displace it, transfer it, whatever you want to call, and their true self will show. All right? So keep it cool. Learn to talk less. For some reason in our country or right now, everyone thinks they know everything. The truth is most of us don't know that much, and that's normal. Make sure you know a few things really, really well. That's okay. Google has the answer to almost every single thing you need. And if it's in medicine, maybe go to UpToDate or a couple of other databases. It's there. It's okay not to know everything. All right, last one's happiness. It's a choice. All right, so you can train your mind to be a little happier. Let's dive into some topics though. Let's go here. So case 1, 18-year-old presents with fever, nausea, vomiting, chest pain after transfusion. It's kind of not specific. Could it be a reaction? Could it be febrile hemolytic anemia? What is it? So they give you labs. Labs tells you Coombs test is positive, which means autoimmune process. Findings, colored urine, maybe some heme was lysed and excreted in some form or fashion. So because they gave you the labs of an autoimmune process going on, this is going to be a hemolytic anemia that's causing this. So that's the answer to that. It would be transfusion hemolytic anemia. All right, next. While transfusing blood, a patient gets a fever, headache, facial flushing, similar to before, but now they have some rigors, and the fever wasn't very high. Labs, negative Coombs. So this is not a autoimmune hemolytic anemia, okay? So what do we call this? Febrile non-hemolytic anemia. So this was a hemolytic anemia, febrile, and now this is a febrile non-hemolytic anemia, all right? So the Coombs test helps you figure out if it's hemolytic anemia or not. The next thing to understand is, what if you give somebody a blood transfusion and instantly they go into like shock? The answer to that is always selective IgA deficiency. All right, those are the 3 topics within 5 minutes. My goal is to give you some positive inspiration, motivation, maybe some words of encouragement, give you 2 to 3 really, really important points within 4 or 5 minutes. All right, hope that helped. Remember, talk less, learn more, state your goals out loud, do 2 or 3 things really, really good every day.